Okay, we're going to go over how to floss and the areas to floss and the areas you can skip. First off, I like to use these little flossers. There's different brands, but they make it much easier. Of course, if you are capable of doing it with just your fingers, that's fine, but I find it's really hard to get in there with my kids' teeth, and these make life much easier. So for most 3-year-olds, there's usually 4 places to floss, and that's where most of the 5-year-olds will get the cavities, so it gives a little extra benefit. The 4 spots are on the bottom, on both sides, and when I'm flossing my kids' teeth, I usually hold this to the outside and go down. So these 2 on the bottom, and on top, up here, between the molars. So for most kids, after age 3, that's the only 4 spots you need to floss. Now, there are about 10% of kids that these front teeth are touching when they are 1 year old. If that is the case, and you're one of the unlucky parents, I was too, I would recommend to floss that as soon as you can, even at age 1. I do it every night, but a few nights a week should work. That's where the doctors and dentist kids get cavities, because all it takes is breakfast cereal getting stuck in there for 2 years, and then you just get a big brown hole in your teeth at 3, and then it's no fun because you don't want to take it out, and it's really hard to fix. So if you happen to have them touching up here, that's the other spot. So some kids 5 spots. Now, what can you get away with? These bottom front teeth, even if they're crowded, I almost never see cavities in these teeth. The reason is there's saliva glands right behind them. They're always protected by saliva, even at night. Now, the top teeth, I see cavities in those all the time, especially in 3-year-olds. If they're having constant milk or juice, or just getting breakfast cereal stuck in between there, or crackers, of course. So these bottom ones I skip even if they are crowded. I mean, if there's food stuck, I would get them, but you want to make your life easier, not harder. For a few really unlucky kids, if the canines and the molars are touching, you may want to add that in, but it's usually just the molars. And then the other trick is these little flossers, you can reuse those. And just like a toothbrush, you wouldn't throw it away every time you use the toothbrush. So what I do is I just rinse off the little gunk on there, let it dry. There's more bacteria on a toothbrush than there is this. It saves the environment, it saves you trips to the store, it makes it easier. I just get a little Sharpie, put different kids' names on here, and then so each kid has their own. And if you're like me and you need to floss that one spot for your 1-year-old, I put one next to the changing table and one next to the bathroom, and even a few nights a week should do that to prevent a cavity at age 3. Okay, so those 4 spots in the back, that up here, and the last thing is, if the back molars aren't touching, then you don't have to worry about it. So if you can see pink gums in between the teeth and they're not touching yet, you can wait even longer. So some kids are lucky and they're not touching for a long time, maybe until age 4. Some kids are unlucky, they're touching it too. That makes it a little more difficult. You have to focus more on diet. But that is my tutorial on how to floss. A common question I get asked is, how do I floss my kids' teeth when it's very, very tight and it snaps through? So let's look at that. Of course, if it's very, very tight, you have to push, and then it snaps through, and then it hurts their gums, and both you and your child are going to be less likely to want to do it. So the trick is to put your thumb as a stopper. So on the bottom, you put it on this side, and you hold the flosser from to the outside, and you push, and it snaps, but then it snaps on your thumb first, and then the gums. Of course, it can't be perfect, but it's much better than not doing that at all. And on the top, same thing. Put it on the roof of the mouth, push, snap through, catch it with your thumb before the gums. Makes it much easier. My other trick is for the top. Either stand behind your child when they're standing up. However, I find it easier if they look up to the ceiling, and you can be in front or stand behind, but if looking up and opening, it really makes it easier to see. You have to see what you're doing when you're flossing in there. Alternatively, you could have them lie down on the ground, just like patients lie down in the dental chair. Much easier to see everything. You can get everything. Just sit behind them when they're lying on the ground, get these top ones. Either way works, and that is the trick, how to floss really tight contacts.